Okay. Well, good afternoon, everyone, and happy Friday. My name is Sarah Shahayeb, and I'm the morning news anchor and host of Health Alert on KBAK Channel 29 Eyewitness News here in town. It is my absolute honor to be a part of this symposium and other initiatives in partnership with Kern Behavioral Health and Recovery Services. So thank you so much to you guys for asking me to be a part of this. Your resources have grown to be substantially vital during this era we now live in. COVID-19 pandemic has highlighted the importance of discussing mental health issues, especially for our youth. They've faced isolation, loneliness, and stress as they've had to navigate distance learning, stay-at-home orders, and so much more. For parents who are tuning in right now, you know exactly what we're talking about. Kern Behavioral Health and Recovery Services is partnering with Assemblyman Vince Fong, the Kern County Superintendent of Schools, Kern High School District, and Kaiser Permanente to host today's virtual youth mental health symposium, the first of its kind, by the way. And today we'll be highlighting local mental health resources available for students, raise awareness, and explain the importance of working to end the stigma against mental health in celebration of Mental Health Awareness Month. As we've been saying throughout this pandemic, we're all in this together, and together we can help our youth get to a better place with their mental health. So before I introduce our first speaker, I'd just like to go over a few housekeeping items with everyone who is tuning in. To our audience, please mute your microphones. Questions are certainly going to be welcome, but just put them in the chat box that's located on the bottom of the Zoom app. The symposium program is about an hour in length, and it's streaming live on Kern BHRS's Facebook page and obviously here on Zoom as well. So without further ado, join me in welcoming Assemblyman Vince Fong, who helped organize today's symposium.
Thank you, Sarah. Good afternoon, everybody. I'm Assemblyman Vince Fong, for those who don't know me, and I want to welcome you all today to today's Mental Health Symposium, the first of its kind here in Kern County. The COVID-19 pandemic has impacted many parts of our lives, no doubt. In March of last year, life as we know it changed and changed quickly. All of us have persevered and have endured through a lot of changes, stress, and anxiety. Many people experience job losses. Our children have dealt with a lot, and many of us have lost friends and loved ones. So we've all been impacted by this pandemic, and especially our children. I want to give special recognition to our partners in this conversation, Kern County Superintendent of Schools and Superintendent Mary Barlow for her leadership, the Kern High School District, and Kaiser Permanente. My sincerest gratitude is to the Kern County Behavioral Health and Recovery Services with Stacy and her leadership team for their work in bringing this symposium to life and taking the lead on this important conversation. I know their work is going to extend beyond today, and it's important we continue to use them as a resource as we navigate into the future. May is Mental Health Awareness Month, as mentioned before, and we want to make sure that as we work together to bring awareness to mental health issues and encourage meaningful dialogue, that we speak directly about to our teenagers how important mental health is in their lives. I have many conversations with parents, students, and counselors, and to see what they are seeing and to hear what they're experiencing. Mental health needs to be a priority for all of us. I would say it affects all of us. Our mental health affects and changes for all of us in different ways. But I hope this symposium brings to light some necessary resources that we can all utilize and we find takeaways to use in our daily lives. As your state representative, I know that addressing mental health should be a core priority for the state. Mental health affects so many in our community and it impacts all of our lives. We cannot make this a side issue any longer. Addressing mental health in our community is a priority for me, and we must be able to confront mental health issues in our youth so that we can make a difference in their lives. So if there's anything that I can do, please don't hesitate to reach out to me in my office. Our number is 661-395-2995. But also, please feel free to reach out to all the resources that are being provided today. And of course, don't hesitate to ask questions because that's important as we move forward in having a conversation about mental health. So thank you for being here, and I'll turn it back over to you, Sarah. You're on mute, Sarah. Sorry.
Assemblyman Fong, thank you so much. Now that my microphone is on. Okay, so our next speaker is going to be Dr. Mary Barlow, the Kern County Superintendent of Schools. And my apologies, Assemblyman Fong, for not mentioning your brief bio that you gave us. I'm going to be mentioning a little bit about Dr. Barlow now. She was appointed as Kern County Superintendent of Schools in 2017 after serving as Associate Superintendent for 2 years. She was elected to a new 4-year term beginning January 2019. Dr. Barlow provides leadership for the county office, operated programs, and supporting divisions for 47 Kern County school districts, serving over 199,000 students. Dr. Barlow earned her Bachelor of Arts in Psychology from CSU Bakersfield in 1994. We like hearing that. And she went on to earn her multiple subjects teaching credential, a master's degree in educational management, her multiple subjects teaching credential, and an EDD in organizational leadership from the University of La Verne. So, Dr. Mary Barlow, you can take the stage.
Thank you, Sarah, and thank you, Assemblymember Fong. It's a pleasure to join you this afternoon to underscore the importance of mental health, reduce any stigma related to mental illness, and to learn more about the resources available to almost 200,000 Kern County students. Our goal is for students to know that they are not alone, that they're connected to a caring adult on their school site, and we want them to thrive. You can move to the next slide. First, I want to provide a brief update on the status of school supports, and then my esteemed colleague, Dr. Brenda Lewis, will discuss Kern High's robust system and supports for students' social and emotional well-being for 42,000 teenagers. Move to the next slide, please. As you know, all 47 districts are now offering some form of in-person instruction while continuing distance learning for those that chose that option. Districts are planning robust summer programs with fun activities and emotional supports for students. And when districts return in the fall, for some that's as early as July, we plan to provide 5 days a week full-time in-person instruction and after-school programming with an option for independent study for those families that choose to remain in distance learning. Through our partnership with Kern Behavioral Health, schools have a referral process to connect students with mental health needs to clinicians and specialists for extra support. Many schools have counselors and behavioral specialists right on site. Let's face it, the last 15 months have been very difficult, and we will feel the impact for some time. So, districts have prioritized social emotional supports within the regular school day, so that all students receive support as they process the impact of the COVID-19 pandemic. To do this, districts are providing additional professional development to staff on trauma-informed care and other strategies to recognize student concerns and teach staff how to respond and connect students to additional supports. At the end of this presentation, we will show you where to go on our kern.org website to learn more about these supports at each individual district. Now, I will turn this over to Dr. Brenda Lewis from the Kern High School District, again, serving those 42,000 teens in Kern County.
If we could go to the next slide. Thank you, Dr. Barlow. It is my pleasure to be a part of this mental health symposium, and I thank you for the opportunity to be able to share with our parents and the audience about the services and supports that we have for our students. As Dr. Barlow said, the 42,000 students in the Kern High School District. Next slide, please. I just want to share a few facts about mental health as it relates to our teens. High school students with significant symptoms of depression are more than twice as likely to drop out compared to their peers. 1 in 6 youths in the United States, aged 6 to 17, experience some type of mental health disorder every year. And 50% of all lifetime mental illness begins by age 14. Suicide is the second leading cause of death among individuals ages 10 through 34, and 16.5% of youth age 6 through 17 experience a mental health disorder in 2016. Next slide, please. just a little information about how the pandemic has changed mental health. Adolescents aged 12 to 17 accounted for the largest number of children's mental health related emergency department visits during 2019 and 2020. In 2020, adolescents aged 12 through 17 increased mental health visits approximately 31% over those mental health visits in 2019. The highest weekly proportion of mental health related emergency department visits occurred during April 2020 for adolescents ages 12 through 17. As you can see by the statistics here, mental health disorders and issues affect a large part of our students, and which is so important why we have to have resources available for them. Next slide, please. Just to give you some idea of the supports that we have throughout the district, we have district level support staff, and we've taken, made a significant investment in our mental health and our social emotional support for students over the last several years, excuse me. This just highlights our district support staff. We have social workers, we have an interventionist, we have a counselor that's dedicated to social emotional learning and restorative practices. We have a district resource counselor, because although you have the mental health and the social emotional issues, we also want to pay attention to any barriers that prevent our students from learning. And we also have a behavior analyst at the district level. Next slide, please. Also at the district level, we have what we call a RAP focus team. Each of our school sites have tiered teams, 1, 2, and 3, that address issues that students might be facing, whether it's mental health issues, social emotional issues, or academic issues. So our RAP focus team consists of a social worker at the district level, a counselor, a behavioral analyst, and an intervention. And they provide assessments and services to students that go beyond what the school site might be able to supply for those students. And the services include, but not limited to, direct counseling, behavior therapy, skill instruction, advocacy, case management, and also referrals to some of our community partners and agencies. Next slide, please. All of our staff, our schools are equipped with mental support teams. And as I said before, we've invested a significant amount in making sure, investment in making sure that we have the mental health support available for our students. So all of our students at all of our campuses have access to a school psychologist. We have a social worker on every one of our school campuses. We have mental health clinicians that our students have access to. We've increased our nursing staff. We were once a district of 39,000 students with 4 nurses. Now we're a district of 42,000 students with a nurse available for every one of our campuses. And we also have counselors on each of our campuses to assist our students. Next slide. Some of the social emotional support that we have available to students when we're in person. A lot of our social emotional supports are embedded into the curriculum and into the classroom. We also have, during this distance learning environment, our students have access to SEL support virtually. And that could be meeting with intervention counselor or their own academic support counselor, a social worker. We also have links to, in our Canvas, which is our learning management system for our students. There's also a link to social emotional supports that all students have access to. And the quick Google guide file that you see there is where the students can go and they can link and click on the link and find social emotional services that are available to them, and exercises and resources that are available that they can do on their own. And also some of these activities are done with students in groups with some of our support staff. Next slide, please. We don't forget about our staff as well, because as I stated, this last 15 months have been a difficult time for also our staff as we've navigated through this pandemic. So we also have staff, SEL, and self-care activities and resources available to them as well. Next slide. We want to make sure that all of our staff are trained in trauma-informed care, and trauma-informed care is an approach in education and other service professionals that is based on the understanding of the prevalence and impact of trauma on physical, emotional, behavioral, and mental health of students. The training allows staff members to recognize either verbal cues or physical cues that students might be experiencing, and how they can recognize that and refer those students to the appropriate individuals that can provide support and services for them. So we do provide that training for all of our staff members. We also have available for our students, we have NAMI clubs on all of our campuses. And we talk about trying to eliminate the stigma of mental illness. And so we're very pleased to have these clubs on our campuses now, because they provide supports to students, whether they're experiencing the mental health issues themselves or whether they have family members. One of the main goals of those clubs is to end the stigma that surrounds mental illness and inform students and create an atmosphere where they are comfortable reaching out to someone and they feel supportive on the school sites. So we do have those clubs on our campuses. Next slide, please. We have a group of community partners that we work with. Some of them provide our resources as referral services for us, but we also have some of them that work on our campuses with our students. And so we're very pleased with the list of community partners that we have grown over the last several years. Next slide, please. One of the most, I think, beneficial resources is when students provide support to other students. And so we have worked on a lot of our school students have reached out to their administration and wanted to provide some type of support to their fellow students as we've been navigating through this pandemic. And so there have been a series of PSA announcements that our students have made, and those are also available to our students to link to on those SEL supports and on our district website. So we just want to show you one of those PSAs where our students are reaching out to other students.
Hey Kern High School District students, I'm hoping and wishing that all of you are having a fantastic school year, but let's face it, life happens, and when it does, it's important to remember that your mental health is just as important as your physical health, and even though we're still in a distance learning format, your campus and their services are still there for you.
Okay, as a parent or a friend or guardian, sometimes you wonder, what do you do how can you assist your student with any mental health issues or any social emotional issues that they may be experiencing as they're going through this pandemic, or just as their experiences as teenagers in general. So the most important thing is to give the student emotional support, and if necessary, get them professional help. encourage a healthy lifestyle for their student, meaning exercising regularly, making that a part of the day, being involved in maybe sports activities, clubs, eating healthy is also a good thing to do to be able to take care of yourself both physically and mentally, and to make sure that your student has regular sleep habits. I know their world has been turned upside down in the pandemic, and you know, they are, maybe their schedules are off, but getting exercise regularly, eating healthy, and sleeping regularly, those are all things that can help contribute to a healthy mind and a healthy body for our teenagers, and to somehow help them feel connected, whether they're able to communicate with their friends, either through, you know, Zoom or some type of social media, just to make sure that since they've been isolated so long, they are able to connect to the outside. And that's one of the benefits of us being able to bring back some of our students on our campuses at this point, because they can reconnect with other students and reconnect with their teachers, and also get involved in their sports activities as well. So how do you access support for your student at the Kern High School District? On every as well as the district website, every school's website has a link on the top of their page that says student requests for intervention and supports. When those students go to the website, or the parents, and they click on that link, there is a menu of items that the student and the parent can identify as to what supports that student might need. And then the appropriate person at the school site, they monitor those requests, and then they reach out to the families and the students to be able to provide whatever support it is that they need. We also have a link on the top of every school's website, a program called Sprigeo. And this is where you can do anonymous reporting. Maybe you know a neighbor's child or someone that's struggling and maybe need the school to reach out to them. We try to be proactive, but we also will follow up if someone says, hey, maybe this person, this family needs some type of assistance. So you can do anonymous reporting, and both of those links are monitored by school staff and some by district staff. And so you'll be able to get someone to reach out to you and be able to provide the services that your student might need. And with that, I will turn it back over to Dr. Barlow.
Thank you, Dr. Lewis. And so for additional supports for districts that are, or parents on the line and guardians who are not part of the Kern High School District, you can take a look at our site, www.kern.org/mental health, and you will see resources for parents, foster youth, homeless youth, and general resources. So with that, I thank you, Dr. Lewis, and I thank you, Assemblymember Fong, for having us be a part of this esteemed panel, and I turn it back over to Sarah.
Thank you so much, Dr. Barlow, to you and Dr. Lewis for all of that insightful information. I was over here taking very diligent notes to share the rest of this information with our community. As a journalist, I have the privilege of doing that, and I'm so grateful to know this community is supporting our youth in our local schools. So thank you for detailing that. Our next speaker is Antonia Mejia Ortiz. She is a licensed marriage and family therapist with Kaiser Permanente. She's been working as a mental health therapist for approximately 11 years. Antonia obtained her master's degree in counseling psychology from CSU Bakersfield and was a McNair Scholar. She began her career working for Clinica Sierra Vista and provided services to children, adolescents, and their families for approximately 4 years. And during that time, Antonia also worked collaboratively with a team of researchers from UCLA to develop Project CARE, one of the first integrated behavioral health clinics in the country to increase access to mental health services in a medical setting. In 2014, Antonia transitioned to Kaiser Permanente Behavioral Health, where she continues to provide therapeutic services to adults and adolescents. She is fully trained in EMDR and specializes in treating patients with emotional and psychological trauma. So we are so excited that you are here with us, Antonia, and to listen to what you have to say today.
Thank you for that great introduction, Sarah, and thank you to everyone who is joining us today. Again, I'm a licensed marriage and family therapist representing Kaiser Permanente's behavioral health team. I do want to emphasize that hopefully the focus of my presentation is to really bring awareness about the signs and symptoms. More specifically, I think Brenda and Dr. Barlow did a phenomenal job kind of laying out the groundwork when it comes to schools. And then, there's the home life, which, is another set of environment that can actually gives us an opportunity to really pay attention to some of these signs and symptoms. So let's talk about adolescence and mental health. So let's go to the next slide, please. So these are some statistics that I found to be pretty startling. According to the National Institute of Mental Illness, 1 out of every 5 teenagers will develop a form of mental illness, and approximately 1 out of every 10 will have mental illness that's so severe that it's starting to affect their daily functioning. So their sleep, their socialization, their eating. Of all the mental illnesses that we see, 50% of those actually start by age 14 and approximately 75% of them by age 24. However, unfortunately, 70% of individuals, of teenagers, do not get the services that they need. So think about that, 70% do not get the services that they need. And sadly, for many of them, treatment does not begin for 6 to 23 years after the onset, which is mind-blowing, right? We have all these resources. What is taking so long to get our individuals, our kids, our children, our adolescents in for treatment? And a lot of times what we see is that this creates a ripple effect of the symptoms just getting more chronic and worse over time. What you also see on this slide is a bar graph that kind of outlines, different categories for mental illness and how it's impacted by different age range. And as we see, kids between the age of 12 to 17 are statistically at higher risk for depression, are at higher risk for anxiety, and are also alongside with the kids who are between the age of 6 and 11, pretty high risk for behavioral disorders. So next slide, please. So what can we do? What can we do at home? What are some of the risk factors? How do we know who is most vulnerable to develop some of the mental illnesses? So one of the research that I came across kind of outlined this graph, which states the common risk factors for individuals, which is the child base, and then the risk factors for family, which is, our family environment and what that looks like. What we find is that the more risk factors an individual is exposed to, the higher the risk of them developing a mental illness. And some of the child-based mental illness can be low school commitment. So not wanting to go to school, missing school constantly, worrying about their body image and how they look, their appearance, displaying aggressive behavior, whether it's at home or at school, having physical violence, either experiencing physical violence or displaying physical violence, struggling academically, starting to experiment with substances, having some kind of attitude towards drug use or antisocial behaviors, and then also being antisocial with peers, so being more isolated, not having a hard time making friends. When we look at the home environment, some of the factors that can really affect mental health for teens is family violence. So witnessing any kind of domestic violence between the parents or even the siblings. If parents have a hard time or struggle with their own mental health. If there's a poor family management, in other words, there's a lot of stress going on, single family household, neglectful parenting. So again, going back to some of the situations that a lot of the kids are dealing with, especially now with with the remote or distance learning is a lot of the parents are having to do the same at home. And so they can't be as attentive to their kids as they normally would. And sometimes, sadly, not purposefully, but sometimes can result into some neglectful parenting. Lack of prenatal care, living in a household where adults are involved in antisocial behavior. And antisocial basically means aggressive behavior, behavior that, you know, is not healthy or can really impact the individuals in the household. Individuals who were born or who were raised or grew up in a family where there's low socioeconomic status. And this is something that we see again with the pandemic. We saw that there was a huge financial impact for a lot of families that inevitably trickled down to the kids as well, and creates a set of worries and anxieties. Maternal substance use during pregnancy, parental unemployment, unplanned pregnancy, and then parent stress. But along with the risk factors, there's also protective factors. And what we know is that kids are very, very resilient. And the more we can maximize these protective factors, even if they have these risk factors, then we kind of offset that risk of them potentially developing a mental illness. So when we look at the protective factors, these are the ones that we really want to amplify when it comes to our teens and our kids, and really try to help them develop these skills so that they're able to cope. So one of those protective factors is having good coping skills. That goes with being able to identify their own feelings, being able to problem solve if they have an issue, if there's any perceived risk of drug use, and social interaction with, and that they have, you know, that they are actually interacting with their friends, that they're charismatic, that they refuse drugs and are not very easily tempted. They don't really are drawn to that. Also, if they have any kind of interaction with their peers, their friends, if they're involved in any sports, in any kind of community activities, all these things really helps the individual become more resilient and also more self-confident. The things that kind of impact children when it comes to family-based is making sure that parents set clear standards for behavior and identify what their expectations are, what the rules are, have consistency, have structure in the home. In addition to that, no violent discipline or nonviolent discipline is more effective than violent discipline. Having good attachment to parents. So whenever the kids, things are unstable, but as long as they have the stability of a good structure within their home environment and with their parents, then it helps them overcome these situations a lot better. And also feeling like they have parental social support. Next slide, please. So one of the things that we've all experienced, as Assemblymember Fong mentioned, we've all gone through this pandemic. And with that, when we look at these statistics that I just talked about, that was before the pandemic. So what we're gonna see, and what wouldn't be surprising to see, is that these symptoms and these statistics are going to be bigger, higher numbers, higher risk for individuals being without help and services. So one of the things that we know is that a lot of our teenagers, alongside with ourselves, experienced a lot of challenges when it came to the pandemic. And one of those challenges is that it shattered their sense of safety. They didn't feel safe anymore. There was this constant fear of someone's going to get sick, I'm going to get sick, I'm going to lose a loved one. And a lot of them actually lost a loved one. What we found is that, according to a study from the University of Southern California, approximately 43,000 kids in the US lost at least one parent due to COVID-19. And nearly 3/4 of that were adolescents. What we find is that kids, when they lose a parent or a primary caregiver, it really shakes the stability of their home and also has a ripple effect into their functioning, not only at home, but academically. So we see that they're at higher risk for traumatic grief, and they're also at higher risk for poor educational outcomes. They're also at higher risk for suicide and unintentional deaths. The other thing that a lot of teenagers experience was social isolation. And for a teenager who's growing up, socialization, having friends, being able to have that peer support is so crucial and so essential. So to be able to lose that, it's been a great challenge for a lot of teenagers. They lost their daily routine. So a lot of them had to get up at a certain time, get ready to go to school, come home from school, do some sport activity. And when the pandemic happened, all of that was gone. A lot of academic stress and difficulties with virtual learning because it was such an adjustment for some kids. And I'm sure for educators as well, being able to accommodate their students as we went on. A lot of kids are not doing well academically. A lot of my adolescent teens are really struggling because not only are they having to concentrate virtually and not have the physical presence and support of their teacher, but also dealing with the stress at home and having to cope with all of that. Another significant impact is that a lot of individuals weren't able to celebrate significant milestones, graduations, birthdays. And so this kind of also creates a sense of grief and loss for them in a very different form. Many families experience financial insecurity. So again, all of that kind of rippled down to adolescence as well. Next slide, please. This graph is actually a recent study from a poll, a national poll that was retrieved from the C.S. Mott Children's Hospital. And what we found is that 46% of the parents reported that they had seen signs of worsening mental health conditions since the pandemic began in March of 2020. And 46% also mentioned that they saw new symptoms. So if the people were already depressed to begin with, this only amplified their symptoms and worsened them. And those individuals who did not present any type of mental illness started to present symptoms of mental illness. So these are some statistics, and it's separated by gender. So from the, and again, these were gathered by the parents, information or data that was gathered by the parents, as far as how they perceived certain symptoms or behaviors in their children. So for teen girls, we saw that 36% displayed some form of anxiety disorder, 31% displayed depression, 24% had sleep issues, and 14% was starting to withdraw and isolate from the family more than usual. 9% of them started to display more aggressive behaviors, more irritability. So next slide, please. So this is the other slide that's very important, and it's all in our head. We a lot of times think that mental illness is something that is in our mind, that it's not, that we can just shake it off. But the reality is that adolescents, if they do not get the help that they need, they will start to see worsening symptoms. And in some cases, this is the biological impact of a more moderate to severe depression, anxiety. Next slide, please. So these are the common symptoms when it comes to depression. These are things that you can look for in your teenager: lack of energy, fatigue, self-harm, having low self-esteem, having trouble concentrating, not being able to feel any pleasure or not do things that they used to do, and also experience mood swings or irritability. Next slides, please. And anxiety is also a very significant piece that is impacted, especially during the pandemic. And these are some of the common symptoms that we see with social, emotional, and academic symptoms. So being socially withdrawn, having a fear of being judged. This a lot of times produces social anxiety. As far as emotional, just having persistent worrying, fearful of what's going to happen next. Academics, not being able to concentrate and resulting in missing school, missing assignments, not wanting to go to school. And physically, a lot of the children tend to somaticize these symptoms with headaches and stomach aches and other ailments that are not medically explained. Next, please. So here are some things that kids can do to feel happier. And these are just some general tips that we can encourage them to do to feel naturally better: completing a task, doing a self-care activity, eating their favorite food, hugging, holding a loved one, running, exercising, getting some sunshine, watching funny videos, listening to music. These are all chemicals, dopamine, oxytocin, serotonin, and endorphins that really help enhance the happy juices in our brain and help us feel better. So I know we have to transition over to our other speakers, so I will pause right there and transition over.
All right, Antonia, thank you so much. I took a lot of photos and I plan on sharing it on social media because it was so insightful. Thank you. And to all of our viewers today, I just want to remind you that in the Q&A chat box, we have listed Kern BHRS's 24-hour crisis hotline. I'll read off the number really quickly and you can also view it there. It's 1-800-991-5272 to be connected to treatment options. And if you're struggling with substance abuse, you can also call the substance use access line at 1-866-266-4898. And again, that is listed there in the chat box. And if you'd like to ask a question, just another reminder, you can put it into the Q&A box. And we will try our best to answer your questions. So just a reminder there. All right, so without further ado, I will switch gears now to introducing Stacy Kuwahara. She is the Behavioral Health Director for Kern County. She oversees the Kern County Mental Health Plan. She's responsible for providing a full array of mental health and substance use services. She's also a licensed marriage and family counselor. Ms. Kuwahara has worked for Kern Behavioral Health and Recovery Services since 2008, becoming director a few months ago, January 2021. Congrats to you. And Stacy, I'll hand things over to you now.
Thank you. Hi, everybody. Welcome. Thank you so much for taking your time to join us today to talk about this really important topic. And thank you so much, Assemblymember Fong, for requesting this forum, supporting us to make it happen for our community. It is so wonderful you've brought us all together to share this information, the resources, and thank you for making this a priority. We are so excited to talk to you today about youth mental health. I have two experts who are ready to speak to you on a few topics, areas that are really meaningful when I think about the mental health needs for our youth: substance use and suicide risk. Anna Olvera is a licensed marriage family therapist working in our substance abuse system as our substance abuse system administrator for Kern Behavioral Health and Recovery Services. She's been working with our department since 2006. She has tremendous passion for helping people in recovery. Anna's been instrumental in shaping how our substance use services are provided throughout Kern County for adults and youth. And we have Jason Gifford. He's joining us, also a licensed marriage family therapist. He works in our children's system of care for the past 10 years. And in addition to working at Kern BHRS, he lectures for the master's program for counseling psychology at Cal State Bakersfield. His work has been really important as he reaches a lot of our kids and a lot of our families. We appreciate both of them taking time to talk with us today. I've worked directly with both Jason and Anna. They're wonderful. I'm really happy to introduce them, and we'll start off with Anna. Hand it over to you.
Thank you, Stacy. Good afternoon, everybody. It's a pleasure to be here as part of this panel. So I'm going to start off just touching slightly on substances, only because substances are an issue that teens deal with all the time, and they definitely affect how they feel and their functioning in general. So first off, it's unfortunate, but kids are exposed to substance use messages everywhere: TV, social media, YouTube. And so it'll be important to have conversations early and often. This is not something that we want to be normalized. And like it was mentioned earlier, it's important to set clear standards for our position as parents in terms of their use, which we want to minimize. In terms of the brain, it does develop over the course of 25 years. So as our teens are in the middle of that, it's important that none of these substances get to their brain because they can interrupt that development process. The brain happens to develop from the back toward the front, and the front is where our executive functioning lies. So whenever there's a potential interruption to that, it causes trouble later on in life. Also increases the risk for addiction as adults. Now, in terms of substances, there's a variety of intoxicating effects. Alcohol is a depressant, for example. Stimulants hurry up the nervous system, and they cause ridiculous damage. So any efforts that we can make as parents to send clear messages that there should be no substance use until after age 21 is really what's going to produce the best outcomes for our teens. Next slide, please. So how can we reduce the risk overall? Like I mentioned earlier, and it was mentioned in the previous presentation, setting clear expectations, meaning no substance use is okay before the legal age. I know that might seem like a hard line, but again, any vagueness in that message can really open the door for allowing for use, and we don't want to do that. Another thing that's important to point out is that it's key to keep your alcohol and medications secured. Now you might think my teen's not going to do that, and that's fine. I don't think your teen will do that, but as you can see in the graphic to the right, about 51% of folks who have access to prescription medication got it from a relative or a friend's house. So that's important as well. In terms of creating opportunities for fun activities with your teen, this is a really big protective factor. Everyday actions like having dinner together several times per week definitely decreases the risk that they'll start using. Also, it's important to check in with your teens about their friends' use. You might find that it's easier for them to talk about what their friends are doing. And again, this just provides additional opportunities to set your standards and send clear messages about how to handle peer pressure and how to practice for situations where they would need to refuse an offer to use alcohol or drugs. It's also important, if you feel comfortable with your teen, to have a plan for risky situations. An example might be that you can have an agreement with your teen to have them call you if they are in a dangerous situation. And not that they're going to get in trouble, but that you'll help them out so that they don't put themselves at risk. Also defining clear lines around drinking and driving. For example, if your teen drives, have them make a commitment to never get behind the wheel if they've drank or used. And same thing, if somebody else is driving them somewhere, never get in a car where the driver has been using. Next slide, please. So how do we have these conversations? Well, the first thing that I can recommend is to make it safe for them to come to you. Now, it's not going to happen every day and all the time, but when they do, it's important to try to listen without judgment. I know this could be a really difficult thing because as parents, we might panic, and it's important to remain calm. Now, also, I would recommend asking open-ended questions. So that means not yes or no questions, but questions that leave them to do most of the talking. And also remember, there's no perfect way to do this. We do our best. If we make a mistake, we acknowledge that, and then we try again. In terms of sending this message, the most important thing you can do as a parent, somebody who provides support, it's to let them know you care, that you love them, that you're there for them no matter what, that you want them to do their best. Now, they might roll your eyes and shrug their shoulders, and that's okay. It's important to remember that your message does come through their ears, even if they don't want you to know that. Another practical recommendation I can make is try having these conversations in the middle of another activity like driving or cooking dinner, cleaning up. That way there's less pressure and less awkwardness about having to face each other and face this difficult topic. If you want to touch on their friends, local friends as well as online friends are important because, again, they influence what your teen is doing. We know that teens lean on each other for help before going to an adult. So your teen needs to know that if they encounter a situation with their friends that is scary, they can come to you for help because there's definitely some issues that they can help with, but there's some that they'll need your assistance with or some of the other resources we've heard of today. And with that, I'm going to ask for the next slide and hand it over to Jason.
Right. Hi, everyone. My name's Jason Gifford. I'm a licensed marriage and family therapist. And like what Stacy said, today I'm here to talk to you about our teens and suicide. So on the next slide, for most people, suicide can be a really scary topic to discuss. But with the increased stress and isolation we've experienced over the last year, it makes suicide more important to talk about than ever. We worry that by discussing suicide, it'll put the idea in their head and make someone more likely to die by suicide. But we know that's just not true. In fact, kids already know about suicide, right? So as you can see on the screen, suicide is the second leading cause of death for people 10 to 24. And in a typical classroom, 3 students will have attempted suicide in the last year alone. So asking about suicide does not make it more likely for them to act on suicidal thoughts. In fact, there's a mountain of evidence that indicates that asking about suicide can help open the lines of communication for those needing help. Many times people who are experiencing thoughts of suicide feel relieved that someone is asking them that question because they have an opportunity to talk about it and no longer have to deal with the secret alone. The other worry that some have is that if they ask and someone is thinking about suicide, they won't know how to help. The good news is that it's your job to start the conversation, and it's our job as professionals to provide that help. So we regularly talk to our children about drugs, alcohol, keeping themselves safe. Suicide should just be another item in this list, right? Having a plan mapped out or knowing who to turn to for help can work to reduce the anxiety surrounding asking about suicide. By asking our teens if they have thoughts about killing themselves, we're just making it okay to talk about, right? It's not scary, wrong, or that you're bad if you have these thoughts. But like other things in life, when there are concerns, we seek to get them addressed. And so on our next slide, we'll show you how to prepare for this conversation. In order to reduce some of our own anxious feelings about discussing suicide, it's important to be prepared. Fortunately, there's just a ton of great resources with some great tips on how to talk to your teen about suicide. So you can see the 3 numbers on the screen. They all offer 24-hour day support and can either assist you in a crisis or help get emergency services to you. First is the National Suicide Prevention Lifeline that you can see below there. The second is the crisis text line, which from my experience, the adolescents are much more comfortable with and more likely to use. This can be accessed by texting the word home to 741-741. And lastly is our current BHRS crisis hotline that Sarah talked about earlier. And with that, our crisis hotline, you'll be connected to a local person who can provide immediate help. And so one easy trick that I use is that I actually have all these numbers written down on a card I keep in my wallet, right? And that way, if I find myself in a stressful situation, needing to help someone in a crisis, I don't have to worry about remembering the numbers or getting my phone out to Google them. I just pull out my card and help people from there. And so then on the next slide, I'll actually show you how to talk to your teens about suicide. And there's some really good websites out there that break down how to start this conversation, such as the American Foundation for Suicide Prevention or the Indian Health Service website that you can ask us about at the end, but they all follow a real similar format. Step 1 is just be prepared with the resources, and congratulations, if you've listened this long, you now have the resources at your disposal to get someone connected to help if they're feeling suicidal. Right? Step 2 is you just want to have that conversation with your teen that's coming from a place of genuine concern, just sort of like what Anna noted. The important thing is to find a time without distractions or interruptions. And this means that we'll need to put our cell phones away and actually pay attention, right? Ask how they're doing. What are your kids' successes? What are their challenges? This can be started with just a simple, hey, are you doing okay? And step 3, if you have concerns about your child's well-being, ask the suicide question directly. Are you having thoughts of suicide? This helps normalize the question and prevents it from being a taboo topic that they feel that they can't bring up to someone. And step 4, and this is the hard part, right? When we hear our child is in distress, it brings up big emotions in us. Some of us want to ignore it, just hoping the problem will go away on its own. And some of us want to just jump in and immediately offer a solution. But the best thing to do in this situation, just stay calm, validate their feelings, be curious about their situation. If you don't know how to respond, just repeating back what they said can show that you're listening. And step 5, if your child is in distress, the best solution comes from working together, right? You're still the parent, you're still the one in charge, but by giving adolescents a choice in the matter of where to seek help is really key to getting their buy-in. And this can be done by saying something like, I hear you're in a lot of pain and are thinking about suicide. I have the crisis hotline number or the text line here. Which can we use to make sure that you feel safe? But you might be thinking, Jason, this is not my kid. They're a moody teenager. They never want to talk to me. And if they are, that's okay, right? The idea is that by asking how they are, and if they're thinking about suicide, you've created an invitation that they can use in the future. And if your teen is not one for talking, create situations where dialogue is possible but not forced, right? Like Anna was talking about. Cook with them, work on a project together, go on a car ride. These are all great for starting those spontaneous conversations. Then, so our next slide, let's think about when to look for help for our kids. So talking about mental health with parents usually brings us to the question, how do I know if my own teen needs help? For this, there are a couple things we want to keep in mind, right? First is you know your kid better than anyone else. Trust yourself. If you see changes in your child's mood, their behavior at home or school, changes in friend groups or withdrawal from friends or other activities, it's a sign that something may be amiss. Second is turn to others who know your child really well, right? If teachers, family members, coaches, clergy are suggesting help, they may see things that worry them that your kids aren't displaying at home. And lastly, if you're concerned about your teen, just ask them, right? Same thing with the idea about the suicide question. It can be as easy as like, hey, how are things going? I've noticed you've been acting a little different lately and wanted to make sure that everything's okay. So on the next slide, I'll turn it back to Anna for this one.
Thank you, Jason. And just real quick, as May is Mental Health Awareness Month, stigma is something that may get in our way in seeking help. So here on your screen, I've listed a couple of common myths. And what I want to just summarize is that seeking help does not indicate a moral failing or that you're a bad parent. Anybody can benefit from treatment, really. Sometimes we hear some concerns about medications. And just as a reminder, medication is only one of the tools in our behavioral health toolbox. It's not the only option. Definitely talk therapy helps as well. I'll also point out that counseling is confidential. There are federal and state laws around this treatment. And so as professionals, we're bound by that. And it doesn't mean we're going to tell everybody about the details of these issues. Next slide, please. So this is just a reminder, as we heard at the top of the hour, it's important to reach out to your school supports. Each campus is going to direct you on who to talk to. Another step you can take is to talk to your primary care provider, because they likely know your child and can direct you. Your insurance provider can also let you know what specific coverage you have to make use of the resources you have. And again, Kern Behavioral Health and Recovery Services is here to answer any question you may have through our hotline and our website, kernbhrs.org. And as we heard from Kaiser earlier, they have their behavioral health resources as well as kp.org. Next slide, please. This is our substance abuse hotline. My staff this line so they can answer any questions you may have if you have a substance abuse problem, your teen does, or another family member. And next slide.
Right, and so once again, you can see our crisis number on the screen. So please do not hesitate to give us a call if you feel there is something we can help with. From a mental health crisis to a question about where you can get treatment, or just questions you may have about mental health in your teen, we're here for you. You don't need to wait until it's an emergency to contact us, right? Just like Antonia said, we find the sooner that people reach out and ask questions and start getting help, the better the outcome.
All right, I'm going to intervene here. You guys are absolutely amazing. I took very, very diligent notes with your presentation as well. And I think we all can attest to having a very difficult time growing up. It's not easy. Middle school, high school, we're all very difficult times for all of us. Put a pandemic into the mix and it makes it even more difficult. So all those tools and resources here in our community should make us all feel comforted that we have that available for our youth. And with that, I'm going to sign off and hand things over to Assemblyman Vince Fong. And thank you all today for tuning in.
Well, I just want to thank everyone for participating. Thank you, Sarah, for emceeing and making sure that we're running on track. Thank you, Dr. Barlow and Dr. Lewis, for the information and the partnership. Thank you to Stacy and her team, Kaiser Permanente. These are weighty issues. There are no easy answers, but we want to make sure to let everyone know that you're not alone. There are resources out there. There are people that care about your student or your child or you as a parent or as an individual and your family. And that we want to make sure that we provide those resources for you and to foster that communication. This hit home to me during the pandemic. I've had a number of parents and students, middle-aged students who reached out to me, sharing very difficult issues that they're dealing with. and counselors as well who've seen things in their students. So this is a very real situation that hit home to me. It shakes you when a number of students and young people approach you just as another asking an adult for help. So if it's happening to me, it's certainly happening to others as well. So I just want to thank again everyone for participating. Certainly, please utilize the resources that's there. If I know that a lot of you may not have or may not feel comfortable asking questions in this type of format, but certainly please reach out to everyone here. We're all here as to be of assistance. So thank you again. And Sarah, I'll turn it back over to you for any last words that you have.
I think that's it. I'm just going to reiterate Happy Friday. We all made it. Congrats. Pat yourselves on the back. That's right. We're all excited for it. And I think that's all. So everyone, we can kick off our weekend, and thank you so much for your time, for tuning in. Again, I think the final version of this is going to be posted online and Kern BHRS's Facebook page. So if you happen to miss the beginning of it and you want to catch up, it will be there for further use. Okay. So with that, everyone, take care and thank you so much. Have a wonderful day. Take care.
Thank you.